Hello friends, how are you? This is Dr. Sri Nagi, Ayurveda and Medicine Doctor and also Isha Hatha Yoga teacher. Many times people feel pain in the shoulder, but when they go for radiographic imaging or when they take x-ray, they don't find any kind of abnormality into it. And when they go for radiologist says like your shoulder is absolutely fine. But still people are feeling pain in this shoulder, and sometimes this pain is extremely cruciating, and it doesn't even get relieved even by taking painkillers. In some cases this happens like you are not able to sleep properly on the shoulder which has this cruciating pain. So today in this video we are going to figure out how Ayurveda can help you with frozen shoulder. It would be interesting for you to know in Ayurveda frozen shoulder is described as avvahuka. So it's a very Sanskrit terminology for frozen shoulder, or you can also understand it as this frozen shoulder symptoms are very much related to the disease named avvahuka that has been mentioned in Ayurveda. So this frozen shoulder is a disease of shoulder joint and adjoining tissues. And according to Ayurveda, this frozen shoulder happened because of Vata imbalance. So it has been described under Vata Vyadhis. Means it has been described under those diseases which are caused by imbalance of Vata dosh. Usually we never paid attention to our shoulder joint, but when it starts restricting your movements for some reasons, like we are not able to rotate it properly either in the forward direction or in the backward direction, then we start feeling some difficulty, and then we start figuring out why this pain happened. Sometimes this also pain got radiated to your arm, but we just take it lightly, and eventually if we don't pay attention to it, it will grow and ultimately it leads to frozen shoulder, which is so cruciating pain, like people feel extreme pain in that. And many times it's been seen that this pain not even gets subsides by taking painkillers, because you can take painkillers for a specific period of time, and too much painkillers if you are taking like for a month, for 2 months, then definitely they are not so good for body, because they are harmful for the body. Extreme chemicals if you are taking, they are not so good for the body because they are going to affect your liver, they are going to affect your kidney. So Ayurveda provides you the natural ways and methods with which you can overcome the pain and this disease of frozen shoulder. I'm not against painkillers, like when it is needed you should have taken painkillers, because nobody should stay in pain. But if you're using it regularly, like for a month, 2 months, daily you are eating painkiller, so I think that is not a great idea. Rather we should focus, we should understand this frozen shoulder disease and try to do various methods and ways that are being described in our ancient sciences to make our health better, so that we should not be dependent on these painkillers so much. So if you are also suffering from this frozen shoulder, please don't worry, there are ways and methods to overcome it. If we consider the modern perspective, what is the perspective of frozen shoulders? So frozen shoulders is considered as the inflammation of synovial joint. You know, there is a synovial membrane in the shoulder. So in modern aspect, if you go, there is some kind of inflammation in this synovial membrane which cause pain in the shoulder joint. And many times it also been seen like there is fibrosis of the shoulder joint which is termed as frozen shoulder. But what is the exact etiology of this frozen shoulder in allopathy or modern medicine, that's been not known. Nobody can say like why this frozen shoulder happened. But in ancient Ayurveda there has been given a reason why this frozen shoulder happened, because according to Ayurveda they say it happens because of excess of Vata. When your Vata dosh got imbalanced, then excess of Vata got lodged in your shoulder area. And in this disease what happens, whenever there is imbalance of Vata dosha, means your Vata dosha got aggravated for some reasons, then this Vata dosha got accumulated in your shoulder joint, and in shoulder joint it caused subsequently the constriction of blood supply and the tissue, which restricts the movement of the shoulder joint and ultimately leads to avvahuka, means restricted movement of your joint. Acharya Shushrut, who was one of the pioneer in the surgery, who is also known as the father of surgery in Indian medicine, he explains because when there is excessive vata in your shoulder region, that causes excessive dryness around your ligaments that are present in the shoulder, around the tendons which are present in the shoulder to support your shoulder joint, and connective tissue which makes your shoulder joint, leading to the stiffness and constriction of the blood vessels, ultimately leads to frozen shoulder. In Ayurveda, this shoulder joint is also considered as marma. Marma is the vital point which is very essential for your body or your day-to-day work. So, if sometimes some kind of injury also happens in this marma, as the time passes, that causes the stiffness of your shoulder joint and ultimately leads to frozen shoulder. In addition to that, there is another reason for which Ayurveda considers maybe it will lead to frozen shoulder. If you are not taking wholesome diet, if you are taking diet which is not good for your body, for example, if you are eating that kind of food which is canned and which is not freshly prepared for a long time, then it will disturb your vata dosh. Or if you are eating very late at night, for example, you are eating at 11 o'clock or 12 o'clock, then that also disturbs your vata dosh. If you are keeping yourself awake by 3 o'clock, 2 o'clock during the night, then that also disturbs your vata dosh. So, whenever these reasons which disturbs your vata dosh come into play, that can also be the reason of your frozen shoulder. That's why in Ayurveda a lot of importance has been given that you take your diet on time, you try to cook fresh meals and try to eat it within 3 hours of cooking. Include a lot of vegetables and fruits in your diet because they are very beneficial, and many of the fruits balance vata dosh. So, these are the small things which can lead to a vata imbalance, and ultimately vata dosh got lodged in your shoulder region and it can cause frozen shoulder. In addition to that, Ayurveda also give a lot of importance, like certain actions if you are doing that can lead to frozen shoulder. Overindulgence in excessive physical exercise. For example, if you are going to gym and you are indulging yourself very vigorously for long hours in a day, and extreme workout you are doing, that can also lead to vata imbalance and ultimately it will lead to frozen shoulder. If you happen to do wrestling with the man who is extremely powerful than you, then also that can lead to vata aggravation and ultimately it will lead to frozen shoulder. If somebody indulge himself in excessive swimming for many hours, rather than he is not professional swimmer and he is trying swimming in the very beginning and he is indulging this himself in swimming for long hours, then that can also aggravate vata and ultimately it will lead to frozen shoulder. If somebody is sleeping with extremely wrong posture during the sleep in the bed, that can also eventually will lead to frozen shoulder. Actually, what happens is when this vata dosh aggravated for the various reasons that I have mentioned, so what it will do, it will dry on the structures that are present inside the shoulder joint and the tissue surrounding it, which ultimately will lead to vasoconstriction. Vasoconstriction means those arteries which supply blood to the shoulder region that got constricted. And when these got constricted, definitely when there is no proper supply, that means there will be no supply of nutrients properly to the shoulder, neither oxygen nor proper blood supply, because blood vessels got constricted because of excessive lodging of vata at that place. So, that definitely then the tissue in that area that will start crying for pain because he is not able to get proper nutrients, and that slowly will started drying up and ultimately it will restrict the shoulder movement, which you feel as like there is some restriction in the movement and there is a pain in the shoulder joint. In addition to that, there are certain other diseases also for which frozen shoulder can be a complication, or there are many times it happens there are underlying diseases for which frozen shoulder will become very common ailment. For example, diabetes people, hypertension. If somebody is having diabetes, it's frozen shoulder is most commonly seen in diabetes, and in hypertension. If somebody has hypertension also, frozen shoulder has been seen more commonly in these patients. If somebody has sometimes hypothyroidism or hyperthyroidism, in these people also frozen shoulder is seen very commonly. In addition to that, somebody has cardiopulmonary ailments, then also this frozen shoulder is very common. Now the question comes like how we will figure out what are the early signs of this frozen shoulder, and how we can figure out what is frozen shoulder, and how you can prevent your shoulder joint from not getting attacked by it. So first we will see what are the early signs and symptoms of this frozen shoulder, and how we can figure out by ourselves like maybe it is frozen shoulder. No question about it that you need a diagnosis of a doctor, but it is always good to know disease by yourself, because the more you understand your disease, the more better judgment and help you can provide for that disease. That's why it becomes very important to just read and study more about that disease or know your disease well.